In favor, aye. All opposed?
Aye.
Okay, do we have an inspector's report today?
Yes, we recently started doing full inspections again. Since that time, we performed 56 regular inspections, 13 walkthroughs for new businesses, 11 follow-up inspections in order to correct problem areas, 9 SR requests from new businesses, and we're currently dealing with 14 illegal businesses that are unpermitted that we're trying to get legal.
I'm curious, in this environment where so many businesses are failing, typically what are the new businesses? Are these new restaurants that are popping up? Or?
Most of them are restaurants that are just being taken over by new parties.
Oh, okay. And of the number of restaurants that you had to consider doing inspections on, how many of those are gone? How many? Do you have any sense of that?
I'm going to say it's probably 5 to 7%.
Oh, okay. So not 50%.
No, 5 to 7%, especially the smaller ones, have changed hands, been sold. And part of the problem is that the new owners don't really understand the full process in the transfer of a business.
Right.
And that's where the illegal business thing comes in. And then we got to hold their hand and walk them through the process of becoming legal.
Yeah. And it's not so much that they're trying to be nefarious, they're just more ignorant of the process?
Most of them, yes.
Oh, would like to think that.
Yes.
All right. Anything else for the inspector's report?
Nope, that's it for today.
All righty. Jeremy, you want to tell us how is the EMS system holding up in this whole coronavirus thing? I don't know if Jeremy's there yet.
Yep, I'm here. Can you hear me?
Yeah, we sure can.
Okay. So we have arrived back at our pre-COVID levels. What we've observed is the normal, what I would say is abuse of the 911 system and the typical cab calls that we've gotten pre-COVID. We are back to that level or that type of call. So that's definitely that started coming back, I'd say, within the last 2 months, 2.5 months. But obviously now we are starting to see some COVID patients, 1 or 2 today, people that are COVID positive. And we've obviously been dealing with the ongoing saga at Staybond Manor intermittently.
Mm-hmm. And are you having any issues as far as, PPEs, that sort of thing, or is that a non-issue?
No, at this point in time, we work through some back channel suppliers that have managed to get us exactly what we needed. So that has worked out well, and we believe that we are well stocked to get through the end of this year and deep into the flu season.
Oh, good. So you're by no means being overwhelmed anymore.
No, not at this point in time. Again, we're concerned. I mean, if you look at the DOH numbers that are coming back up, and I know it dropped yesterday, but prior to that, they were adding several thousand cases across the state several days in a row. So, we're still pushing along. We've had a couple members that have contracted COVID from working, so they've been off, but it hasn't been nearly the number that we originally feared.
The one thing I don't understand about those numbers of new cases, whether it's per Berks County or the state, is, some of that's relative to how much testing they're doing. So, are those numbers completely applicable to those numbers from 3 months ago when maybe the test run is available? I don't know the answer. It's just something I think about. Sure.
It is probably scalable. I would agree with that.
Yeah. All right. Well, that sounds like good news that you don't have your head under you. You got your head above.
Absolutely.
Okay. Discussions on the need for a health officer. My thought was, geez, if we can't even round out this committee, how are we going to get a health officer? But I have some things to report on a new committee member, and I think that may open up new possibilities. Any discussion on that? The health officer thing? All right, well, then let's go into some old business. Health code amendments. Are we ready to do anything on that? They're still grinding out the documents there? Or?
Still a work in progress.
Okay, nothing we need to do today.
No.
All right, and then Berks Teen Matter update. I saw a couple things. They're going to change the name, and they sent out that video, which I watched. That was really nice. The thing that commemorated all the student volunteers for this year. Did they show that at a Zoom meeting, or was that just distributed for the public to watch whenever they wanted? You know?
Yeah, that was distributed by email just through committee members to share with their organizations and then to spread it through that way. We usually had in the past a gathering where we do, you know, a dinner and a nice little, give them nice little treats and send them
Right.
off, which we could not do this year.
Yeah.
So that was what they came up with instead.
Do you know, has that had with the crisis with the kids not being in schools, has that impacted on, you know, recruiting kids for those positions for next year?
I believe it has, and also with the schools closed, the HRC, the Health Resource Center, is closed as well. So they're trying to move some of that stuff to virtual to remind the kids that it's still available, and they do private Zoom meetings, one-on-one.
Oh, wow.
Yeah, but I'm sure it's very tough to have it be as effective, you know, in that situation. You never know, though. Maybe some people would feel more confident going on a screen rather than, I don't know, who knows. I was also, in that video, I was interested to see that the pregnancy rate had dropped, what, 30, one was 32, one was 30 or something. Do you remember what they were, Shelley?
I think they were 36 and 32%, something around there.
Yeah, I forget which was the
county
city.
versus the city.
Yeah.
The city was down less. That was the
Right.
32%, I believe. But I still think that's fabulous progress.
Perfect, yeah, for a program that's only been, and I would think that, you know, the longer the program has been on, I wonder, and that only goes through that's only available at the high school, is that right?
Right now, it's only available at Reading High, yes.
What grades are at Reading High now? I can't keep it straight.
9 through 12, I believe, are there right now.
Oh, 9 is there.
Switching.
Okay.
Yeah, but I think 9 is back.
Oh, okay. Yeah, because you got to get to some of these kids by 9th grade, I would think.
Yeah, the hope was before this to work with the district to get into middle school.
Mhm.
But now they're doing some strategic planning, and the thought is to perhaps go to another high school outside the city in the county where there's other, you know, like the next highest rate, so that we can spread the word a little further.
Where is the next highest rate? Do you have an idea?
I don't know what the updated numbers are.
Just curious.
Hmm.
All right. Any other general discussion anything you want to bring up about the Berks teen matter? They didn't decide on a new name yet, did they? Or okay. Yeah, I think that's a good idea, changing it. Okay, the Lead Abatement Coalition. I don't know if there's anything going on with that right now. Haven't heard a peep out of anybody. I guess that's on the back burner. Now, the good news on the question of new member recruitment, I had spoken to the TJ, the guy who runs Berks County Medical Society, and he put me on to a Dr. Mary Kelleher, who I did not know. She has worked down at the Reading Health Dispensary in Penn Street for the last 17 years. And now I think she's going to be the director of the Berks County Health Unit, I think the one out here on Rockland. And so she's worked with the city, the inner city kids or inner city people mostly. And she seemed, when I got in touch with her, she seemed like real fired up about it. So where we stand with that is I procured one of the applications from Linda Kelleher, and I mailed that to the doctor. So I have not heard back. I sent her an email 2 days ago to just say where things stand. And Shelley, you said you have not heard of it coming back. If it did come back, would you know that, Shelley?
I process all the application forms for all the boards, so I would know.
Okay. And if I don't hear from her again in another day or two, I'll send her another email. I don't think I have a phone for her, but I think she's going to do it. She sounded like she was like, "Oh, thank you for inviting me. This is great." So, and she works with a lot of. She's certainly much more in the mainstream of Berks County medicine than I am, having been retired and out of the hospital for many years. So I'm hoping that we can tap her for some other people to join the committee that would be vibrant members and good additions. So that's all I have on that. Hopefully, maybe with a little bit of luck, she'll be here for the next meeting.
Oh, be nice.
But in the meantime, if anybody has any other ideas of committee members or anything, for all means, let us know. Okay.
Is that any relation to Linda?
I don't know. I asked the question and didn't get an answer, so I didn't know whether I should ask the question again or not.
I asked the question, they're not.
No. Oh, okay.
Who knows? Yeah, I'm not surprised I've never bumped into her. She's been here all these years. Any other new business or anything anybody would like to discuss? Jamal, what's happening with the eviction and all that stuff? I know it was pushed back again, and I heard that the CDC came out with something. And is that where does that stand? Because I think it's important for.
It's thank you for asking, John. The process did start, and it depends on where you are in the process. You will receive a different type of decision from the judge when the case is presented. For instance, those who were late on their monthly payment prior to COVID, chances of them to stay in the house in their dwellings is highly unlikely, and the judge will rule against them to be evicted. Whereas others who are actually being victimized by the COVID situation and they can prove that, they will be able to. The magistrates will work with them, and the president and judge had actually issued a decree to that effect that they will follow the CDC rules, and they will continue with that to the end of the year. Come into play at that point some of the challenges and the technicalities that we are facing. As you all know, that the Pennsylvania Housing Financial Administration's offered, and it just expired September 30th, to help people with their rent up to $750 a month, and as well as homeowners to pay their or pay part of their mortgage up to $1,000. But the challenge is that most of our residents been facing is that the uploading of this information to the website. So they were asking for proof of being laid off, proofs of that reductions in income and what have you. And a lot of people could have qualified, but unfortunately, it did not. They were not approved. As a result of this, Berks County Redevelopment Authority, who is assigned for this task, have actually requested to continue receiving application until the end of October, and hopefully we will be able to basically rally on one concept, on one thing in there, and that is continue to accept applications until all the money is consumed, and that is the angle that they are coming from. So that's on one front, and the other front is actually our human relations services here are accepting, and they have seen a tremendous amount of phone calls. It's actually they are up to about 150 phone calls a day, and they are trying to work with families, and we're trying to work with them at this point in two aspects. The very first one is negotiate with the landlord, and some of the landlords are actually willing to work so long as they can receive the money. HUD has recently approved and amended the ESG, the Emergency Solution Grant, to accept 6 months in the arrearage and 6 months in advance. So we have about 12 months altogether, and that all will help to basically start easing off the situation. We're not out of the woods, but I would say that the situation is under control at this point.
Good, because a few months ago, the sense I got from you was that there would come a single day where there would suddenly be an onslaught of people on the streets, homeless. So you don't think it's going to be that sudden mass eviction that you had feared would be so bad? You think things are looking better in that regard?
I agree with, yes. I think that's the case, that we are not going to see a massive eviction there, and simply because the deadline have been extended several times, and even when the federal deadline expired, I believe the CDC came in and said because of the pandemic, then that they will extend the eviction to the end of the year. So these are the reasons, plus the fact that the majority of the landlords are actually, they are people who would like to just pay their bills as well. So evicting somebody without having a reliable family to replace them is not exactly in the works at this point. So as a result of that, if they can get something instead of nothing, they will work with us.
Have
And
you
that's
seen
what we see.
Have you seen any contraction in the number of available places to rent because of this? You know, where owners are reluctant to get into the rental market now. Has that been an issue? Do you know?
It's been challenging to find out an apartment before COVID. So, and it continues to be the same. Okay, and all what we can do is we're probably going to play musical chairs if that happens.
All right.
I mean, so the calls continues to be on an average about 100, 150 calls a day. The finding places continues to be a challenge, especially if it's a big family.
Well, it sounds like things are at least looking up over what.
Yes.
So that's a good thing. All right. Any other new business? Well, then I guess we could set. You want to meet in 2 months in December? The first Tuesday would be the 8th. Shall we just put that down tentatively? Probably as good as anything. All right.
We have it on the paper here, December 1st. On our.
Oh,
agenda.
that's right. We usually do the first Tuesday, not the second. What am I thinking? Yes, I'm sorry. The first. Oh, yeah. It's even on the meet. Oh, yeah. Duh,
Yeah.
yeah. All right. I'm looking at the calendar. Yeah. Oh, don't mind me.
Oh, we won't.
Is election day the second Tuesday? I was thinking of something that was on the second Tuesday. Is that
No, that's the first Tuesday in November.
election day? Is
Yeah, it's the first Tuesday of November.
I don't know where I got the second
Yeah.
Tuesday in my head. All right. Well, then I guess we'll all meet then.
December
All right,
1st.
everybody stay safe.
Happy Thanksgiving.
And
Yep.
you too.
Yeah.
Happy Thanksgiving to all.
Time's
Bye-bye.
just flying by.
Bye-bye.
So
Bye-bye.
long.